Welcome to Raw Online. I am Dr. Punita Rani, Assistant Professor of Anatomy. Today's session is about the deltoid and the rotator cuff muscles. Before going to the topic, just we'll revise the upper end of the humerus bone. The upper end of the humerus bone, you can see here the head of the humerus. This is the greater tubercle or the greater tuberosity of the humerus bone, and this is the lesser tuberosity of the humerus bone, and in between the greater tuberosity and the lesser tuberosity there is a groove which is known as the intertubercular sulcus or a bicipital groove, and this green line indicates the anatomical neck of the humerus bone, and this is the surgical neck of the humerus bone. This surgical neck of the humerus bone is clinically important as the axillary nerve winds around it. So these are the important bony markers or bony prominence of the upper end of the humerus bone. This slide is about the deltoid muscle. The deltoid muscle, this is the deltoid muscle, and this deltoid muscle is a bulky muscle, and it looks like an inverted triangular shape, and then it forms a round contour of the shoulder. And if you see, there are a lot of muscle fibers. Now we'll see what is the origin and insertion of the deltoid muscle. This deltoid muscle is again covered by an fascia. So that fascia is known as the deltoid fascia. This deltoid fascia, it blends with the pectoralis major fascia, and above it blends with that of the periosteum of the clavicle, the acromion process, and then spine of the scapula, and then it blends with the infraspinatus fascia. And below, if you see, this deltoid fascia blends with that of the deep brachial fascia, and then it continues as a lateral intermuscular septum. Now we'll come to the origin of the deltoid muscle. The deltoid muscle fibers can be divided into anterior, middle, and the posterior fibers. Now we'll see the origin of the deltoid muscle. As I said, the deltoid muscle fibers are divided into three parts. One is the anterior part, middle part, and the posterior part. Now we'll see where the anterior part arises from. The anterior part arises from the anterior border of the upper surface of the lateral 1/3 of the clavicle. This is the anterior part. This is the clavicular part of the deltoid. This is unipinnate in nature. Now we'll see the middle part. The middle part, it arises from the lateral border of the acromion process, and these are multipinnate fibers. Posterior part, it arises from the whole length of the lower lip. If you see here, it arises from the whole length of the lower lip of the crest of the spine of the scapula. Again, these fibers are a unipinnate. So the anterior fibers, the middle fibers, and the posterior fibers, they are unipinnate, multipinnate, and again it is a unipinnate muscle. Now we'll see where does these fibers goes and insert, how they get inserted. Insertion, the fibers converge, the anterior, all the three fibers, the anterior, middle, and the posterior fibers, they converge for an insertion to the deltoid tuberosity. This deltoid tuberosity is V-shaped impression involving the lateral surface of the shaft of the humerus. When you look at this, this is the right lateral view of the shoulder. If you see here, you can see the deltoid tuberosity of the humerus. Okay. So the middle part, which is a multipinnate, how they get inserted is that they form a 4 intermuscular septa which descends from the acromion to interdigitate with the 3 septa ascending from the deltoid tuberosity. So the strongest part is the middle part or acromial fibers, which is multipinnate. Now we'll see the nerve supply of the deltoid muscle. It is supplied by the axillary nerve, which is a branch of the posterior cord of the brachial plexus. This winds around the surgical neck of the humerus bone, and then it gives off an cutaneous nerve of the arm, which is a superior lateral cutaneous nerve of the arm. What is the action of these fibers? We have the anterior fibers, that is the clavicular fibers. They help in the flexion and the medial rotation of the arm. The middle fibers, which is the multipinnate fibers, they help in the abduction of the arm from 15 to 90 degree. And then we have the posterior fibers, which is again a unipinnate. They help in the extension and the lateral rotation of the arm. So the single muscle, deltoid is a single muscle, but the fibers, they have a different action. If you see the anterior fibers, they do the flexion and medial rotation of the arm. The middle fibers, they help in the abduction of the arm from 15 degree to 90 degree. The posterior fibers, extension and the lateral rotation of arm. Now we'll see the structure. What are the structure under cover of the deltoid? This can be divided into what are the bones, muscles and the joints and the bursas are under the cover of the deltoid. First we'll see the bones. We have the bones is the coracoid process, the greater tubercle, lesser tubercle of the humerus, intertubercular sulcus of the humerus, the upper part of the shaft and surgical neck of the humerus. What are the muscles they are present in the undercover of the deltoid? We have the pectoris minor, coracobrachialis muscle, biceps brachii, both the heads, and then pectoris major, latissimus dorsi, teres major, subscapularis in the lesser tubercle, and we have the supraspinatus, infraspinatus and teres minor in the greater tubercle, and a long head of the triceps from the infraglenoid tubercle. So these are the muscles that is present under cover of the deltoid. What are the vessels? We have the anterior and the posterior circumflex humeral vessels. A nerve is again an axillary nerve. And joints and ligaments, we have the shoulder joints and its ligaments and coracoacromial joint. And what are the bursa? We have only two bursas. One is the subacromial bursa and the subdeltoid bursa. This picture shows this is the subacromial bursa. So if you can see here the acromion process, the supraspinatus tendon and muscle and the tendon, and this is the subacromial bursa. This is the axillary nerve and we have the posterior circumflex humeral vessels. Clinical test for deltoid muscle. Here the examiner resists the patient abduction of the limb by the deltoid. If the deltoid is normal, the contraction of the middle part of the deltoid can be palpated.